Well, let's just make sure everything is correct and visible. Looks like it's visible so far. Let's go to my channel. We'll just double check this here. Okay. I think that's good. I think we're almost ready to start the show. Just going to share this on Twitter, and then we'll go ahead and we'll get this show on the road, That's what we're here to do. Just get the show on the road. Okay, here we go. Just going to post this real quick, and then we're going to get going. Here we go. Okay, folks. Well, let's get this show on the road, shall we? And, all right, here we go. Off to a good start. So, let's see. Yep, here we go. All right, good afternoon, everyone. I think, for the time being, I am technically Dr. Patrick Lockwood, and here we are on episode 45 of UnShrink Me. It's already been 45 episodes, weekly episodes. What a miracle that is, literally. Thank you all for coming out, watching, listening, etc., etc. I genuinely hope that this is helpful for you. So this is a weekly podcast, if you're brand new, that is focused on mental health, psychiatry, clinical psychology, and related topics so that everyone who is out there seeking therapy or psychiatry or counseling or guidance or whatever can get a more realistic, more accurate understanding of the services they're seeking out. So this is a weekly podcast dedicated to mental health and skepticism, criticism of the industry to protect the consumer. So I am not some brilliant person. I am not some amazing person. I am just your ordinary psychologist who happens to have a podcast talking about what I believe is ethical, what I believe is scientifically accurate or realistic or reasonable given what we know about clinical psychology, psychiatry, and mental health in general. So this is not some crusade of mine. This is just my attempt to help make sure people get the help that they need. And they get it accurately, and they have realistic expectations so they are not harmed by malicious providers, gurus, narcissists, and the like. So welcome to this week's episode 45, miraculously. I hope you all had a good Thanksgiving and you're safe and healthy and everything is okay. Today's podcast is going to be kind of an interesting one because we got some really big topics to discuss, including therapeutic neutrality, which is a huge topic for a lot of people for political reasons and scientific reasons and professional reasons. We're also going to talk about sabotage in therapy. Who sabotages therapy and why? I'm also going to talk just a little bit about this rules of engagement post that our buddy Nick Tabor discussed. I want to make sure we spend some time on that. And finally, I think we'll talk about what it means to engage in therapy, treatment, transference, and all that. So these are the topics du jour. Welcome. And as always, this podcast is not NOT. Not sponsored by Celsius, but maybe at some point. I love this stuff. It's probably killing me, but who cares because it tastes great and it gives me the energy I would like to have. So, welcome to today's podcast. So, let's start out with a banger. So, just a few hours ago, a person that I don't believe I know professionally or personally at all on Twitter posted this really interesting thing about neutrality. And this is another person he was reposting. So it's like a turducken. There's like a post within a post within a post. And so the original poster was this person named Mel, and their handle is at THE_MEL_JAR, the Mel Jar. I don't know Mel, I don't believe. I think we're in the same state, if I'm not mistaken. But anyways, Mel had this really long thread on neutrality and how neutrality is important in therapy for the patient, not the analyst. And not in the sense that analysts shouldn't be neutral about themselves, but just that we should try to be neutrals for the benefit of the patient. It's a very long thread. It's a very thoughtful thread. She has me blocked for some reason. I don't know. But anyways, the person that I'm immediately commenting on reposted her thread. His name is Mollerite, and his handle is at JESUSRGLEZ. Jesus RGLEZ. Anyways, he said about Mel's thread, good example of how neutrality has everything to do with the patient. The thread points to something very important as well and forgotten, in parentheses. Countertransference is unconscious and not contained. Enactments, since they're not conscious, are a posteriori, so observed afterwards. So that is the post that I'm going to comment on, because I think that is something that every patient, if you're talking to a substance use disorder counselor, if you're talking to a pastoral counselor, if you're talking to a therapist of any degree level, a psychiatrist, a coach, a guru, whatever, whoever you're talking to, I need you to understand something for your sake so that you are not harmed by the profession. So, again, this person that I'm commenting on said something very straightforward. Mel's thread on neutrality points to something very important as well, which is, hey, Jonathan, good to see you. Glad you're here. Which is countertransference is unconscious and not contained, which means that it's not something that's limited and you can magically interact with in the moment in most cases. Enactments, since they're not conscious, he says, are a posteriori. They're observed after the fact. So here's what I said just half an hour ago. This is what I posted. I hope that everyone hears me loud and clear, both therapists and patients, but patients especially. Neutrality, this is what I said, is an idealistic fiction. Ergo, it's a narcissistic act. Analysts hold on to neutrality like a transitional object, like a security blanket, because of the terror of being a real person with real needs or feelings in a professional setting. We ought to allow patients to have a relatively balanced and objective experience with us and treat all people with respect and impartiality to the extent that it's humanly possible. Neutrality, on the other hand, is impossible because of countertransference, just like this person said. Literally, no clinician is capable of keeping their biases or baggage out of the room. So I want to just say that last part again, so everyone can hear this. Dear therapist, dear interns in graduate school and getting your hours to get licensed, dear licensed professionals who think their shit doesn't stink, dear longtime psychotherapists and psychoanalysts, you are not magically keeping your baggage out of the room. No professional, there's no professional in clinical psychology and psychiatry who is somehow so smart, so insightful, so self-aware. They've been through so much psychoanalysis or some shit where they're literally so smart and so self-aware that they're perfectly keeping their baggage out of the room. That's not possible humanly because of what Mollerite said. Mollerite said in his post, he, she, whoever said in their post, that countertransference is unconscious. Now, some reactions we have, to be fair, as professionals, are more conscious. We can see them. We have an explicit fear, anger, sadness, whatever, where we're relating to the patient in a particular kind of way. That happens sometimes. So some countertransference is unconscious, and some of it's conscious. The more conscious our reactions are, the more obvious and reasonable they are, the more we can do something about them as professionals. But dear psychoanalysts, dear psychiatrists who have a God complex in particular, dear clinicians who've been doing this a long time, dear substance use disorder counselors, dear interns, just know that your shit stinks. It stinks like everybody else's, and that you have countertransference that's often unconscious, and you don't recognize it until after the fact. That's what Mahlerite is saying. Now, I'm not saying that every minute of every session, every word that a therapist says is countertransference that's, biased, maybe even harmful or malicious. That's not what I'm saying. What I'm saying is a lot of the stronger emotional experiences, the more talkative moments a therapist has with a patient, are almost always about the therapist and not about the patient. They're almost always about some countertransference, some need or desire on behalf of the therapist. Now, that doesn't mean logically that saying nothing is the solution. That's not the solution. Therapy is this really complicated experience. In fact, I think in 45 episodes, I've never really defined therapy. I did this bro podcast a couple of months ago where we tried to define it. I don't even think we came up with a good definition, if I recall. But psychotherapy, in the most general of terms, is a helping relationship. It's a professional, structured, boundaried helping relationship. And it's where you both negotiate clinical goals to solve clinical problems, right? That's a very high-level definition, which could include all sorts of things. It can include focusing on symptoms of depression. It can include focusing on unhelpful interpersonal patterns, like why am I so passive with these kinds of people and why am I so reactive to those kinds of people? So those are all grist for the mill in therapy. The thing about it is, though, is that good therapists, and I'm going to say this as clearly as possible, good therapists are hard to find because most of us are regular people with a regular understanding of our personal issues, our biases, and our baggage. And because of that, even with very good supervision or good, like go to a good consultation group or go get psychoanalysis if you want to burn thousands of dollars, you can do all sorts of things to try to become more self-aware and have better boundaries and be more realistic as a professional. However, even the people that have worked the hardest at being self-aware are never going to be perfectly aware as professionals. It's something I've gone through all the time, where I'll be doing supervision or I'll be doing a session. I don't do a lot of therapy anymore, thank God, but I do sometimes. And even then, I try to be super on top of why am I having this feeling and what is it about me and all this stuff, so that when I'm talking to I typically do couples or family therapy, but when I'm having this reaction, why am I pushed and pulled in this direction? I want to make sure I'm on top of that to the extent that it's humanly possible, but it's not perfect and it will never be perfect. And I will make mistakes and I will let my feelings get in the way of the work or of the boundaries that we've mutually set, or what good professional common sense should be, right? Because I am not perfect, right? And that is something that patients need to hear. If you or your loved one are seeking out psychotherapy, you need to understand that the person that you're sitting across from is not idealizable. They're not. They are sometimes intelligent, sometimes very thoughtful, but your therapist is not a guru, or at least they shouldn't be. Your therapist is not so brilliant or so self-aware or so healed that they can magically help you. That's not what good therapy is. Good therapy is an imperfect relationship that has structure, that has professional boundaries and ethics, and a mutually agreed upon goal for creating, goalposts for progress towards your clinical goals. So it could be something like I said, learning to speak up for yourself more, or it could be something more symptom focused, like why do I have this low negative mood state that persists despite time and circumstance, right? Like symptoms of depression. So it's really important for patients to understand that neutrality is not real. It doesn't happen. It's never happened in history. There's no neutral relationship, right? Neutrality is a narcissistic wish or belief of professionals who are terrified of being real, ordinary people. And so if your therapist or your analyst in particular, because I think they masturbate the most about this, but if they're talking about this, they're probably just interested in themselves being pure and stuff like that. And they're not really interested in you. That being said, good clinicians, just like good doctors, should be impartial to the extent that it's humanly possible. Because the science of psychology, the peer-reviewed literature we have on depression and PTSD, isn't super reliable. We kind of phenomenologically understand what these illnesses are, but the idea that we perfectly understand them is silly. We have a good enough understanding of the symptoms that the symptom clusters might equate to an illness called depression or PTSD. But what causes it and what fully alleviates the distress isn't super clear for most people. So it's really important that everyone understand that your therapist, who can be very helpful, is a flawed, ordinary, normal person. And that's okay. In fact, that's ideal in my belief system because ordinary people can help ordinary people. That's not, I think, an uncommon, strange thing to say. So if your therapist cares exclusively or excessively about neutrality, it's probably about them and not about you. Now, let me say something that's tangentially related, but not the same thing as neutrality. So a tangential concept to neutrality is balance, and a second one is impartiality. So, good therapists are capable of trying to stay balanced, to be aware of their desires and their feelings and their reactions and their countertransference in the moment if they can, and after the fact when they're thinking about the session. But they're able to stay presently focused on you and try to receive what you're saying and what you're feeling and what you're experiencing so that they can be open and available to you while also having professional boundaries and ethics. That's a hard balancing act because balancing being open and receptive, some people might call it empathic, but that's the wrong word. Being open and receptive and aware requires some degree of being aware of yourself and what makes you, the therapist, not very open and you, the therapist, not very balanced, right? So it's this really tricky, weird thing of being open and aware and available for patients while also being aware of your stuff simultaneously in the moment so that you can adequately engage in a boundaried and ethical way. And that's a tricky thing to balance in the moment because in the moment, if you're super lost in an experience with the patient, which has happened to me, you'll say things and do things that you think make perfect sense, but might be more about you and what you believe you want to have happen in session, not about what's necessarily best for the patient. So this happens all the time with psychoanalysts. Analysts love to make interpretations, which I think is fine. I think interpretations can be useful. But the thing about it is that when analysts make interpretations, sometimes it's just for them, for their own sense of their egotistical desire to be right and fancy and sophisticated and see all the layers of being a complicated person, which may help the patient, but is usually more about the analyst. And so really good therapists are trying to balance the difference between paying attention to themselves and their experiences and their feelings, what pushes and pulls you as the therapist, and paying attention to other people and their needs. That is the hard part about being a good or even an excellent therapist. And it's not easy if you're doing it right because it requires a lot of openness and beginner's mind and non-judgmentality and awareness of yourself and awareness of the other person, the context and the history and all these. There's thousands of things to keep track of, which no human being possibly can perfectly thoughtfully. Mathematician says, ordinary people help ordinary people. 100%. Exactly. Right? Like, I think some of the most healing experiences in therapy don't come from some brilliant interpretation or from some magical coping skill. Most of the time, what's super healing is usually ordinary experiences of feeling understood, feeling seen, being validated, being mirrored by the other person. That's usually what people find helpful and healing. But those ordinary experiences take time to develop. You can't just have those all the time or right away. So that's why therapy is a relationship. That's why I defined it earlier as a relationship. So to be clear, to be super clear, to get back to the original point, neutrality is a fantasy. It's a narcissistic fantasy by people who don't understand their narcissistic experiences and injuries and needs, by clinicians who believe they're smarter and somehow magically separate from or neutral, right? Like, that is a fantasy. And so your therapist is not neutral. Your therapist should strive to be balanced. Your therapist should strive to be impartial. But being impartial doesn't mean being neutral. It's impossible in all reality. So it's really important. I care about this a great deal. I'm spending all this time on this because it's such an important point. If you're seeking out therapy, if you're seeking out psychiatry or family therapy or couples therapy, the person you're sitting across from is not neutral, ever, in any moment. They're not neutral about politics. They're not neutral about gender. They're not neutral about race. They're not neutral about sex or sexuality or religion or anything, or about you. They're not neutral about you. In fact, most of the time, the therapist is very biased in your favor, unfortunately. And I say unfortunately because what that means is they're lacking some impartiality. And the problem with that is that when you're biased in favor of the patient, when you like the patient, you're less open to things you don't like about the person. Now, that's not a black and white thing. It's a shades of gray thing. It's different for different people with different types of countertransference, as I just said. So, some therapists will have an easier time liking you because of the similarities or life trajectories or family differences or culture or whatever. And sometimes it'll be more difficult to like you. And so there is no perfect therapy relationship, and there is no perfectly neutral therapy relationship. And the analysts that claim neutrality are holding on to it like a security blanket, like I said, because I think they're terrified of being a real person and having their real person needs, feelings, and baggage hurt the other person. So they kind of slip back into this grandiose defense of neutrality and I can be perfect or I can strive to be perfect, which is bullshit. It's literally impossible. Literally. So I hope everyone understands. Your therapist can help you. Your therapist will imperfectly help you, hopefully. Hopefully, you have an ordinary person you're sitting across from who is doing extraordinary things in terms of being balanced and trying to be impartial and trying to balance the challenge of being self-aware and also open and receptive to yourself at the same time. That's the extraordinary thing that good therapists do. Good therapists are not just receptacles for your feelings. We're not just like friends you vent to or whatever. Good therapists are not some sage person that knows everything like King Solomon or something. Good therapists are regular people who might be a little above average in intelligence, higher verbal fluency, maybe their personality is a little special and spicy, a little narcissistic or something. But that doesn't mean at all that they're impartial, perfectly, or neutral ever. They're never neutral. Jonathan just commented, so I just want to read his comment and give it some space because I think he's probably going to say something very useful, as he always does. So Jonathan just said, I think part of the problem is that when some people say neutral, we mean political neutrality versus emotional personal neutrality. I almost always mean the first on X, on Twitter. Yeah, and I think that, therapists, psychiatrists, healing professionals, medical doctors, whatever, they're going to have their political beliefs, like Jonathan's talking about. And I think that if you're trying to demonstrate being an adult, I believe, this is my take at least, then you're going to try to be politically impartial or neutral if it's possible, because what you're trying to do is represent the profession. You're not trying to represent some team of bureaucrats or some set of ideologies that doesn't have anything to do with your work. However, the problem is that when therapists, like myself and others, are on social media platforms, we do get caught up in these nonsensical political things, and it's a shame because it ruins the credibility of otherwise credible people, unfortunately. So what I would argue is that, we should try to avoid topics like politics when possible if you're a professional. Because if you want to be just a regular person, back to the ordinary thing, and be perceived only as an ordinary person, that's great. I have no problem with that. However, if you're trying to post politically, or if you're trying to, I don't know, have a discussion about your professional knowledge and experience, politics unnecessarily taints people. And I think that, you can say all sorts of smart and wise things, and people will have a really hard time trusting you because of politics. I think this happened, unfortunately, with Jordan Peterson once upon a time. I think one of his big downfalls back in the day, and I hope he's okay. I hope Jordan is healthy and everyone is okay. But I think what happened to him was he started out by doing these very common sense things in his earlier years, in his earlier lectures, talking about basics of CBT, basics of mental health, clean up your room kind of stuff, which is good for everyone. It's good, like general self-helpy psychotherapy kind of advice. But I think the more he got caught up in the politics and the culture wars, the more his ordinary common sense stuff about personality and IQ and stuff like that became tainted. And I think no one who was politically motivated cared about whatever he was saying at the time. And so for me, it's just kind of a question of, is it really helpful? Is me talking about this political thing helpful? Also, if you expect me to be a talking head for psychology, who cares what I think about aliens or conservatives or progressives or wokeness or what? Who the fuck cares, honestly? What people care about is, are you a decent enough person? Are you a smart enough person? Are you an aware enough person to actually maybe help me? Right? That's what most people care about. Are you a decent enough person? Are you an aware enough person? Do you seem insightful enough? And do you seem relatively smart enough person that you can actually have a good relationship with me and help me? And so talking about basically anything, unfortunately, on social media can pervert and distort who you actually are as a person, at least your image of who you actually are. That being said, I say all sorts of absurd things on social media. So I'm not trying to be a hypocrite. I'm just trying to say, I don't think politics is it. I think politics makes us all disgusting and stupid. I don't think we need that to be a healthy society. But that's just me. So, again, just to wrap this particular segment up, neutrality. Neutrality is a fiction. Neutrality is a fiction that people who are unaware of their narcissistic tendencies and narcissistic injuries use to hide behind. It's a security blanket. I said it's a transitional object, a la Winnicott. People who are aware of their narcissistic issues, professionals, but also people of other disciplines, but especially professionals in clinical psychology and psychiatry, will cling to neutrality and objectivity like an infant clings to a teddy bear or a security blanket. And I want to point out, just for the sake of fun and hypocrisy, my very first transitional object is actually right behind me on the shelf there, if you can see it. It's that turtle up there. I think it was given to me at like 5 or 6, something like that. Anyways. And then my more recent transitional object is right there on that cat post. Her name's Willow. And by the way, there's nothing wrong with transitional objects. I'm not saying that to be mean and nasty. I'm saying that to explain a mechanism. So for those of you who don't understand who Winnicott is and all these psychoanalytic terms like transitional objects, Winnicott and other analysts talked about what young people do to transition from being in a helpless dependent state when you're an infant to a more autonomous or reciprocal state of being as a more mature creature at the age of 2, 3, 4, 5, whatever it is. And so we have these transitional objects like stuffed animals or blankets or whatever it is. And all of us use these to kind of like have magical special relationships because it's this perfectly soft, cuddly thing or whatever. And it can be perfect. It can be idealizable while we're going through this very difficult time of becoming our own person and having to take care of ourselves and having to speak up for ourselves when we start to get language at like 3, 4, and 5 and stuff and use our motor skills to get our needs met. And we have to now rely on people by trying to have a relationship with them. Whereas when we're infants, it's just kind of like the expectation is we're going to be taken care of. But as you get older, you have to work to be taken care of. And so the reason that I'm using this particular phrase, transitional object, because they're real and they're necessary, I think, for like growing into a more difficult, mature identity existence, is that's exactly what these psychoanalysts do and these guru therapists do. They cling to this idealized view of themselves, that they're super smart or they're super objective or neutral or whatever it is, because they're trying to be not harmful. They're trying to be not real people because they believe their humanness is dangerous. And to some degree, they're correct. They're absolutely correct. When therapists are selfish, when psychoanalysts or psychiatrists or whatever are selfish and narcissist, they hurt people. All the people harmed by psych meds are harmed by lazy, ignorant, narcissistic prescribers who just care about themselves more than they care about the patient. And that's true for therapy too. And so I'm all on board with being afraid of, having like a healthy fear and a healthy skepticism of myself and the ways in which I can hurt patients. It's 100% the case that I can and will hurt people. Now, hopefully, 9.9 times out of 10, it's very minor and not tragic, right? But the ideal would be never hurting someone, but that's idealism, and that's narcissistic, infantile, grandiose fantasy that these people who cling to neutrality like they cling to a security blanket do. And so learning to be okay with the fact that you are going to be imperfect, you're going to have enactments, as Mahler said. You're going to miss your countertransference in the moment because it's impossible to be perfectly self-aware and perfectly aware of the other person at the same time. We cannot perfectly attend to self and other. It's impossible. So it's really important, and I don't mean this in a mean way, that you understand the people who care about being the best, or the people who care about being very neutral or whatever, are most likely a little narcissistic and they don't get it. And they're terrified of hurting people. Maybe for good reasons, maybe for bad reasons, maybe because that's their way of giving away that they're capable of very dangerous things, which most of us are, by the way, just so you all are clear. Another comment here, so I want to get to this comment. Math Magician says, exactly. Do your methods help the person become better? Most humans are not Renaissance humans who are experts in everything, right? And that's true. That's absolutely true. There's almost, I'm trying to think of a person I've met in my life. And I met lots of great therapists, and I met lots of good people who I consider, former mentors and current mentors who are great people. Excuse me. They've helped me, and they've taken an interest in me, and they've shown me my gifts, and they've helped me succeed in the world. And that's awesome. I was just texting one of them right before this started. And they're all people. They're all regular people. They're all regular people with regular people needs. And also, they're gifted in some way, in their own little unique way. Some of them are less gifted. Some of them are more gifted. But the reality is most of us that are doing the work are just kind of ordinary. And because of that, it's really important to be clear that because most people who are doing psychiatry, clinical psychology, counseling, etc., are just kind of ordinary, then expect that they have an ordinary relationship with you with extraordinary rules, boundaries, and things like that, so that they can actually help you, right? Which leads me into my next post by a guy named Nick Tabor. And Nick and I have been talking on Twitter now after months of me talking about his post. I think we finally discovered each other. So let me get to his post. Okay, so let's talk about Nick's post. I'm going to repost it real quick. So here we go. Okay. So Nick Tabor at NickTaber. Hope I'm saying your name correctly, Nick. This is what he said 3 days ago. So I'm going to try and read the whole thing and then try to, talk about what I agree and what I disagree with, right? So here's what Nick said about 3 days ago. And Nick is, I think, one of those critical, maybe not anti-psychiatry, but definitely on the very critical side of things that I think he and I share a common goal from very different perspectives. So here's what he said 3 days ago. He said, for me, a big red flag with therapists is if they have requirements for how you engage with their service. Such as a rule that you must come once a week or something. To me, it would suggest that they don't see your healing journey as one that is necessarily self-directed. I want to stay the absolute hell away from someone who wants to exert power over my healing journey. And such requirements are a tell that they wish to, even if they spin it otherwise. Not having sovereignty over your own inner life is a truly terrifying thing. So Nick said a lot of things in there, including that very provocative last statement. So let me see if I can, hopefully, try to talk about what makes sense and where he might be a little misguided to some degree. But maybe I'm wrong. Who knows? So he said, just to re-quote what he said, for me, a big red flag with psychotherapists is if they have requirements for how you engage with their service. So let me just start with that very general. And then he gives a specific example. But let me start generally, and then I'll get to his specific example next. So the first thing he said is, I'm very concerned. It's a red flag when therapists have specific requirements about how you engage with their service. So, Nick, I want to encourage you to think about something like getting your oil changed. So if you drive a car, Nick, you have to have maintenance of your car, right? So even if you have an electric car, there's no more oil or coolant anymore, but there's other types of like regular service you have to do. And so in order to get your car to function as effectively as possible, now this metaphor, a lot of people are not going to like because it's very anti-humanistic and it's very mechanistic, but just work with me for a second. See if it makes sense. So if you really care about your car, right? If you really want your car to last as long as possible and you really value your car, you'll do things like take it in for its oil change every, 5,000 miles or 3,000 miles or whatever it is. And so that's a constraint that the manufacturer of the car has created to make sure your car lasts and functions as well as possible. Now, it's entirely possible that your car manufacturer has created that every 5,000 miles rule because it's just a way to help big oil make money. That's possible. And I'm very sympathetic and open to that possibility. I really don't know personally, even though I'm a car guy, I'm not aware of any research that's been done that says how long the intervals should be between oil changes. I don't know. I really don't know that much about oil and how robust it is over time, how much it burns up and, loses its viscosity and stuff. Like, I don't know. Maybe I should look more into that before using this metaphor, but this is what I'm going with. And so you have some regular time intervals to maintain your car so that it can be functional and even optimal to some degree, right? You need to flush your coolant once a year. You need to change your brakes when they get down to a certain seconds, I think is what it is. So or 30 seconds. And so there's all these things that you have to do to kind of keep your car in good fighting shape. And some of these parameters, I'll just call them parameters. So there's parameters that every automaker has to make sure your car stays healthy. Likewise, in mental health and medical health, there are all sorts of parameters that you have to have in order to make sure your body and your mind stays healthy. For instance, all of us need people. We all need to be seen by people on a regular basis to feel important, because we don't feel important by ourselves in a vacuum. We feel important when we're interacting with people and experiencing positive interpersonal feedback, right? So that's important for mental health, right? And so the same thing has to be true for cars and for general mental health for therapy. If you believe as a therapist, for instance, that seeing somebody once a week is the best way to treat somebody because that once a week feedback is going to be enough for them to have a certain kind of relationship with you, then that might be actually a very important thing. Now, to say that every person in individual therapy has to be seen once a week, rigidly, or else, that's stupid, right? The frequency of sessions should be co-decided. The therapist might have some intuition, for instance, some belief based upon what they've learned about the patient and what they know about the patient and how they're interacting with them and how the patient makes them feel and all these things, that seeing them more frequently would be helpful. For instance, it's kind of clinical common sense that if someone is currently suicidal, like they have an active plans and active means to in their lives, that you should see them more frequently and touch base with them more frequently to make sure they're okay, right? That is a requirement that I think I will never give up on as a professional so long as I have a license, because I want to do what I can to protect people so they don't die. And I think that's fairly common sense. And so, Nick, what I would tell you is that sometimes there are clinicians who have arbitrary guidelines and rules. In fact, I would be willing to bet that your main critique is about like psychoanalysts, right? Because analysts, as I've said before, are often narcissists who don't fully understand it, and they have their own needs that they're getting met with their patients. So seeing somebody 3 times a week to do regression therapy or 5 times a week or whatever it is really about them. It's not really about the patient. And so from that perspective, Nick, I'm on board with you. Why is this person dictating my life? However, the frequency of sessions is often so that we can keep some momentum going, Nick. And that momentum relationally, just like if you're dating somebody, right? This is another analogy that's probably going to get me in trouble, but if you're dating somebody and you don't meet frequently enough, you're going to lose interest in that person. The same thing is true with therapy. And so the therapist and the patient should mutually negotiate session frequency. The therapist should make an objective, expertise-driven, hopefully, recommendation about the frequency of meetings. And the patient should then be able to say, I agree, I disagree based upon these 5 reasons. And then we can talk that out and negotiate it, right? Like any healthy relationship, we negotiate time spent with each other. That's what should be happening, Nick. So there's some comments here, and then I'll get to Nick's specific examples. So let's start with the comments. So first, from Jonathan. Jonathan said, I'm going to allow a client who struggles with chronic emotional dependence infusion to come to therapy 3 to 4 times a week, which they have requested in the past, because that fosters maintenance of their problem. Their impulses to come very often is not determined by their healing journey, but by their tendency to do more of the same. Right. And so he says, I'm not going to allow them to come all the time when they want. So, Nick, this is an example of why we should have a large say in why the patient's requests are not always honored, right? Because Jonathan's example is a great example. So just to summarize his example again, if we have figured out through the first couple of sessions of meeting people and getting to know their issues that this person has like a pathological dependency issue, which does exist, it's a real thing, it's not just a made-up term, where they desperately want to be close to you as a professional, it might not be super healthy for them if their goal is to learn how to be independent or interdependent, right? Because I think the interdependence is the catchy thing that's been talked about for the last 20 years. But if your goal is to develop some sense of interpersonal balance, then just acquiescing to the request of the patient to meet all the time, meet 3 or 4 times a week, is actually very pathological. It's enabling a behavior. It's co-signing a behavior pattern that has kept them stuck at the same level of individuation for all these years. So our job is actually to tell the patient, no, I disagree with your request to be seen more frequently, because it's actually going to help maintain this problem you came to therapy to fix, right? So good therapists, like Jonathan just said, are explicit about the boundaries of therapy, how frequently we meet, because if we're not explicit, we're playing a game with the patient. And the most pathological thing we can do is play a game with the patient. The healthiest thing we can do is be honest about our formulation, what we believe is happening, and why it's happening between us and inside of you, the patient. So step one, be honest about what you think is going on in the therapeutic relationship and inside the patient. Step two, we talk about if they agree, if that makes sense to them or not. Step three, then we negotiate boundaries with the patient. We go, okay, that makes sense. That doesn't make sense. Let's do this. Let's meet this frequently. Let's meet not that frequently, right? Those three steps, not rocket science, but hard to do because it means overcoming your biases, the people pleasing that a lot of therapists have, or the narcissism that other therapists have, And so that's why it's hard, Nick. And that's why it's important that maybe the patient's request to meet at a certain frequency is not so good for them. So just to go back to thank you, Jonathan, by the way. Here's what Nick said. Such as a rule that you must come once a week or something, which we just discussed. So I hope everyone understands that, frequency of therapy is not arbitrary, or at least if you have a good therapist, they should explain to you in crystal clear terms why they think this frequency is helpful. Good therapists will tell you very straightforwardly, I believe this frequency of sessions is helpful for these 2 or 3 reasons. And if they can't explain it to you, like you could to a 5th grader or something, to a 5-year-old or a 7-year-old, then they're probably full of shit, or they're probably very insecure, or they're probably just kind of naive or unsophisticated. And that's going to happen. There's a lot of ordinary people out there doing therapy. So let me pick on this next sentence in Nick's post, because I think it's an important one and I don't want it to get lost in this conversation. So he said, to me, setting a rule about frequency of sessions is the referent here. But he says, to me, it would suggest that the therapist doesn't see your healing journey as one that is necessarily self-directed. And so, Nick, let me say this very clearly to you and to all patients, that it is certainly your life. So if you come to me for supervision or for psychotherapy, which I hope you don't, by the way. I hope you go see someone else for therapy, because it's not my favorite thing to do. I'll do it, but I don't want to, honestly. Supervision, consultation, professor, love those things. So anyways, I genuinely hope, you see, Phil says, am I late? Yes, you're a little late. That's okay. Glad you're here. I genuinely hope that everyone understands that if you come to therapy, that this is not a self-directed process, because you're signing up for a professional relationship. So yes, it's your life, and you should definitely live your life on the terms that you want to live your life by, according to your values and your principles, your goals, your cultural boundaries, and all these things. And if you come to therapy, psychotherapy, what you're signing up for is a professional relationship where both parties have a say in what we're trying to work on and how we're trying to work on it. So therapy is not self-directed, Nick. It's not one directional. It's not like the person's coming to you and then walking away with no impact of the other person. So therapy is always 2-directional. Now, therapy is never about the therapist's personal needs, beliefs, or goals, which goes back to that conversation around impartiality and neutrality and all that. So therapy is not about the therapist per se. However, therapy is always going to involve the therapist's lived experience, knowledge, ethics, boundaries, and culture at all times. And so you should be aware that the person you're coming to talk to is a person, which means that you're going to be leveraging that relationship with them. And maybe that relationship is mostly fantasy, because maybe you're doing what's called projecting. Maybe you're mostly having a fictional relationship with the therapist. Or maybe you're having a mostly real relationship with the therapist and you're kind of seeing them for who they really are to some degree. That varies from patient to patient and therapist to therapist and relationship to relationship. So please be clear, Nick, that this idea that your healing journey is self-directed is kind of a red herring. It's kind of like it's not the correct focus, because in my experience, and I think if you look at the good therapy literature, what really is the best predictor of therapy outcome is the patient's experience of the relationship. So it doesn't mean that the patient is 100% in charge. I always tell patients, this is your therapy, so whatever you want to do with me, I'm happy to do with you specifically. But that doesn't mean I'm going to do everything you request of me, because I will disagree and push back if I believe something you want is not good for you, based upon the goals you've told me you're trying to accomplish with me in therapy, not according to some brilliant narcissistic thing I believe is good for you because I'm a genius, right? So I hope you understand what I'm trying to say, Nick. It's not just like the patient is in charge. I think that that's a nonsensical way of talking about it, because that's not true. It's like it's a mutual relationship that's professional. Just like you negotiate with the guy who fixes your brakes, you negotiate with your therapist, right? So it's always two ways, but it's like whatever the customer wants, we'll try to do so long as it's actually good for the customer, right? But it requires a very ethical person to not do narcissistic things where you take advantage of people, which I keep talking about here. He says, I want to stay the absolute hell away from someone who wants to exert power over my healing journey. And such requirements are a tell that they wish to, even if they spin it otherwise. And I think you're correct that there's a number of people, especially analysts, who believe very narcissistically, they're very well defended, they're very intellectualized, and they have perfect explanations of why they're 4 times a week is ideal. But I think that it's not all clinicians. I think some people are really good at negotiating respectfully with patients the frame, the frequency, the goals, the expectations, professional boundaries, ethics. Like, I am not going to expect the patient to hold me accountable to my ethics code. I'm going to expect myself and my colleagues to hold me accountable to my ethics code. It is literally up to me to be on top of that. It is never your job as the patient to make sure I'm being ethical. It's also never the patient's job to make sure I know everything I need to know about their illness, right? So it's very important, Nick, that you're very clear that, like, sometimes there are responsibilities in therapy that are only purely solely on the therapist. Like being aware of my countertransference, not the patient's job. Being aware of my biases and my baggage is my job. Being aware of my ethics, my values is my job. Being aware of my limitations and what I know and don't know, that's my job, right? However, some things that are the patient's job include figuring out what they believe their needs are, being honest in therapy, talking about what they believe they know to be true about themselves and what they don't know to be true, what their wishes are, what their goals are, what their insecurities are, etc. So I think some people do spin their narcissistic, totalitarian, do as I say because, and some people are having ordinary, healthy boundaries. And I think it's a mixture, Nick. I don't think it's all or nothing. And he said, finally, not having sovereignty over your own inner life is a truly terrifying thing, which is totally true. He's totally correct. Because sovereignty is sacred, right? There's something sacred about being your own person and being allowed to have your journey the way you would like to have it. And I think that's true. The only pushback I have for that, Nick, is that in life, in literally all relationships, sovereignty is limited. It's limited by what we disclose and how we act. Because what we disclose and how we act is sending signals to the outside world. So long as you're in relationships and not living in a cave somewhere by yourself, you're never going to be fully sovereign, Nick. No one is ever going to be fully sovereign. It's impossible, unfortunately. And your healing journey, if you choose to seek out professional help like a counselor or a psychiatrist or a psychologist or whatever, like your professional is going to hopefully empower you and encourage you to be as sovereign as possible while also having a professional relationship, because that professional relationship is where the magic is in therapy, right? Per all the research. right? And so I really hope everyone understands that doing good therapy is very hard to do because it means trying to promote autonomy and interdependence and healthy boundaries and ethics in a professional way with patients. That's not always super crystal clear. Some of the subtleties of our pathology can really get in the way of successful therapy. Just like on the therapist side of things, therapists and their baggage, their pathology, their issues, their unmet needs that they don't recognize they're playing out with their patients can easily get in the way and sabotage therapy and destroy the sovereignty of the individual they're sitting across from. So I agree that sovereignty is a good goal, but I don't believe that most people who are coming to therapy are looking for sovereignty, Nick. I think they're looking for relationship. They're looking for interdependence. They're looking for support. Some people have very infantile wishes to be rescued or taken care of, and that's all fine. And that is where it's hard to maintain the sovereignty piece because you're helping them grow developmentally to a more adult psychological state. And that's hard. It requires patience and experimentation and boundaries and ethics and all these things. Mathematician says, what should a therapist do when a patient does not respect boundaries due to a catastrophic event, such as a sudden breakup? Well, I would need to know more about the context here because it depends upon what your clinical work is about. Number one, what are you doing in therapy? Are you working on depression? Are you working on relationship issues? And what boundary is the patient breaking because of the catastrophic event? Like, are they breaking the boundary where they're like flirting with the therapist? Because that's not okay. Are they breaking the boundary of like not coming to session? Are they breaking the boundary of not paying the therapist? Like, what boundary are they breaking? And just because these things aren't okay doesn't mean we can't work through them. You can work through what's called the eroticized transfers in some cases. In some cases you can't. And like help them understand their intimacy needs better without doing something illegal and unethical like flirting with your patient or having sex with them. Never do those things. That's bad. Never, never, never. Likewise, for not paying your fee or not showing up to sessions. Like whatever the thing is that they're doing, whatever boundary they're not honoring, it's worth discussing. And most of the time, you can probably work through it unless there's like some serious other pathological issue at play, like a serious personality problem or a transference issue or a countertransference issue you haven't picked up on yet. But most boundary issues in therapy can be worked on and improved, and you can even get something healthy out of it. But in many cases, going back to those I know better therapists, it's like they don't see how they're taking their stuff out on the patient. They don't see how they're getting their personal needs met with the patient. It's not okay. So I think it just kind of depends on what you mean, mathematician. So if you have more information, feel free to share it at some point. Well, we were supposed to get to a lot more things. We talked about neutrality and we talked about sovereignty and Nick Tabor's post. I was hoping we could talk about how patients and therapists sabotage psychotherapy. I'll save that for next week, and we'll talk about it next week because it's a really, really, really good discussion prompted by Jonathan Shedler, who I appreciate and respect on Twitter. So much more to come, so much to talk about. But for today, we're just going to have to sign off because we are at the end of our time here together, and you know, it's always good to have a bit of a cliffhanger here. So thank you, everyone, for coming out and sharing and telling all of us your thoughts about what we're talking about here. Thank you so much. I really appreciate you coming out, Jonathan and Phil and Mathematician and everyone else. It's really awesome to have you here with me and with us. And I hope that I see you all next week for our next podcast, because I think every week there's always new ideas and new issues. And, you know, the spirit of this podcast, if you're new to this, just to reiterate, is I want to make sure that anyone who's seeking out psychotherapy or treatment or rehab or counseling or pastoral counseling or couples therapy or whatever it is, if you're out there and you're struggling, or someone you love and someone you know is seeking out therapy, I want you to be the most informed, the best armed, if that metaphor works for you. I want you to know the most. I want you to have as much information as possible, as much perspective as possible from someone who does this and teaches it and supervises people and consults. Like, I sit in many different chairs in this profession, so I have a well-rounded perspective to some significant degree. And so I'm not here saying I'm the best. And if you ever take that from this podcast, that's not on me, because that's not what I believe. Sincerely, you've heard me say it before. What I believe I'm doing here, what I want to do, what I want to accomplish in my heart of hearts is very simply, I want to protect people from the profession, because there are so many well-meaning therapists who hurt people unintentionally. There are so many decent people who violate their ethics without knowing it. There are so many good people, really good, genuinely good people, who unwittingly make mistakes. They don't understand their countertransference or whatever it is. And because of that, they will unintentionally be counterproductive and in some cases be harmful as professionals. So what I want all of you to understand from this podcast, especially consumers of therapy, what I want you to really understand is that it's possible to get help from mediocre people. It's possible to get help from people who are average, who aren't super smart or the best. They don't have to be the best. They just have to have some common sense and some ethics and some values and be aware of things like countertransference, bias, unmet needs, things like this. And I want you to hear it from me, and I want you to see the ways in which I fail and give you examples of that so you understand what to look for in those professionals out there. Because if nothing else, I'm a good, bad example, right? And that's true for every professional. And I want you to understand that the profession can certainly help you if you find the right culture fit, the right personality fit, the right relationship for your needs. And so my real hope, my genuine hope is that if you have a loved one who's seeking out therapy or who's struggling, if you have friends and family, if you yourself are struggling, that you do everything you can to find the clinician that's the most ethical, the most informed, and the most interested in having a quality professional relationship with you. Because that's the best predictor of therapy outcome anyways. They don't have to be DBT masters or brilliant psychoanalysts or great CBT therapists or ACT therapists or whatever to help you. You can get helped by interns. I have some interns that I think are phenomenal. And so I really hope that you understand the spirit of this podcast. It's not to trash the profession. The profession is doing a great job. The American Psychological Association is doing a phenomenal job of ruining the reputation of the profession. And so I'm not here trashing anyone, except for maybe myself. I'm here saying, here's the reality. Here's what's possible. Here's what we can do. Here's what we should know. Here's how it can go better. Because I'm optimistic that it can get better with good supervision, with good training, with good colleagues. Everything can get better. We can help people better. And you can get helped by people who are maybe not even the best, you know? So I hope that the spirit of this podcast is clear. I hope you understand what I'm here to do. I'm not here to spread negativity. I'm here to be reasonably critical and skeptical because the profession needs it. And very few people who are anti-psychology and anti-psychiatry are doing it in a reasonable way. They're doing it in a narcissistic way, or they're doing it in a way that serves some unmet needs of their own. And my life's pretty good. I got a really cute cat back there. Everything's pretty chill. I make good money. Relationship's good. Family's good. Relationship with God's good. Everything's pretty good. So for me, this really isn't about me. This is really about the world, what I can give back to the world. And I really hope that it makes sense why I'm doing this and why I hope it's helpful. And I hope it is helpful. And if it's not helpful, tell me. Tell me what I can do better. Tell me what I can talk about that would be more helpful, so I can share what little I know and what experience I have. And I hope to see you next week. And as always, I like to end this podcast with a joke. So while you're liking and sharing and subscribing, please listen to this joke. So, Thanksgiving just happened. I went to Thanksgiving dinner with my in-laws, as I usually do here. And it was nice. It was perfectly nice. We watched football. The Cowboys did a good job. And, we were just talking about the people that were at the dinner table and their careers. And, there were some interesting characters at the dinner table. And, One of them, who was at the dinner table, had this really lengthy career, just retired as a mechanic, interestingly enough. And he spent most of his life working in like specialty body shops and things like that. And then for the last 10 years of his life, he worked as like an exhaust guy, as a muffler guy, because he worked on like high performance cars and fancy cars and stuff like that. Excuse me. Anyways, so we're sitting at Thanksgiving dinner and he's talking about his cars, and I love cars. So we just talk cars all dinner basically. And he was telling me that, he just got kind of burned out near the end of his life, and it's hard on your body if you're always working on cars. And he's older, so it makes sense. And, there was kind of a natural break in the conversation, and I didn't really know what to do. I was kind of feeling awkward, and I said, wow, it sounds like a really exhausting job. All right, I'll see you all next week. Take good care of yourselves, take good care of each other, and I hope that you have a good weekend, and I'll see you soon. Bye-bye.